IVF cycles, generally lot of injections have to be taken, maybe to the tune of 50-60 injections. Sometimes in previous IVF failure patients, they may have to take more number of injections. Actually, these injections, patients are scared because of the pain. And the main anxiety when we counsel for IVF, they generally ask how many injections will be there. I heard a lot of injections have to be taken previously, before the cycle, after the cycle, before the transfer, and after the transfer also a lot of injections. So as soon as we say, now there is something where you can reduce the number of injections and you can have the reduction in the pain score, so that itself will reduce the anxiety. So that is something actually which we demand from the patients demand from the clinicians, because see, already we are taxing the patient by giving a lot of injections. But if we can have something to reduce their pain, we are really doing something contributing for them to relax regarding the treatment. When the pain reduces, generally the anxiety will come down. When the anxiety comes lesser, then their entire IVF journey becomes smoother and healthier. IVF generally demands a lot of things from the woman's body. But if there is something like needle-free injection system, at least we can reduce the pain and they'll be more comfortable. Generally, the most difficult part of IVF is anxiety. They generally don't know what is going to happen. That anxiety starts from the stories they hear about this IVF demands a lot of injections. As soon as any human being, when they hear about injections, their first query or anxiety is about pain. So that is the biggest worry. Basically, needle-free injection system, right from a child as a human being, even if they are grown up to a woman, their main worry is about the number of injections. By using needle-free injection system, at least we can reduce the number of injections, even though they may have to take some injections. But we can reduce the number of injections. This will actually increase the acceptability of IVF treatment and patients will be generally comfortable. If there is no needle, will it affect the success of IVF? But definitely no, because needle-free injection system that deliver the actual amount of drug to the desired place, that is the subcutaneous region. Then in our study, in our trial also, we have not seen any difference with regard to the number of eggs, with regard to the number of embryos or the clinical pregnancy. Basically, it is a device, and needle-free injection system is a device. Initially, now the patients have to take the injections from the hospital to use this needle-free injection system. It's a pre-developed system that uses very high pressure to deliver the drug across the skin, across the superficial layers of the skin to the actual target location of the subcutaneous fat. All our thought process, we can only put a needle and deliver the drug inside the fat. But due to high pressure, because of the texture or the peculiar structure of our skin, the drug can be delivered through this device. So it's a high pressure technology system.